Welcome you all. English all right except for you. English all right?
Jolly, I think. That's brilliant.
She can speak English. So we don't need translators then. So it's a very, very short time, 1.5 hours is nothing to learn everything. So in this shortest possible time, we will be able to just get an idea how to work on the neck, back and knees, and head also, headache also is good. Some ideas how this pains arises and other things. I'll not go much detail about all the types of pains, back pains, all the varieties of knee pains, arthritis and all those things. I'll not go because it's a short time. But I'll get you what you need. It's like a feeding, spoon feeding of exact nutrients embedded and just give it to you, something like that. And some models where usually what we follow and what we think to design those exercises and some exercises. And I'm sure that you will get an overview or idea that you can design your own exercises for your own pain or somebody else's pain. So that much I can assure. It's not complete, but it is just a beginning part of the phase of learning. Is it all right? Okay. We'll start with our home. Talk namaskaram. Keep your eyes closed. Take a deep breath in. We human beings are evolved to stand on our feet from quadruped to biped. Quadruped means 4-legged, biped means 2-legged. So we evolved from this to this. So there is a complete structural evolution of the spine, of the feet, of the hands and everything. And with this development, there is also a bit of disadvantage of keeping the body erect on 2 feet. So it has its own advantages and few disadvantages like pains and aches. To start with, we have 4 major weight-bearing areas of our body. First is our neck, second is our lower back, third is our knee, fourth is our heel. Okay? And depending on the weight you put on each and the strength of the bone, the tendency to get aches and pains will be increased. The neck has usually around some 5 kg weight of the head, 1.5 kg of the brain and 4 kg of the skull and neck areas. It will be on the neck. So say for example, if we sit and work for a long time and we stare at the computers or monitor, or we do things which my head needs to be held erect for a long time. So the muscles will get little spasm or kinked and that can lead to pain. Again, say for example, somebody is using mobile, bending down. Each angle you bend, maybe some 17 to 20 degree angle you bend, there is 2 or 3 kg weight increases. If I bend this much and use mobile for long, along with this 5 kg weight, there is a bend and there is more pressure on the head and the weight will be much more, maybe some 10 kg or 6 to 8 kg of the weight on the neck. And if we do this for long, the weight will be much more. So it depends on something called as COG, center of gravity. Not just our own neck or back, but also the gravitational force and how we are putting our body posture. So that's how different areas have issues. Back is usually in this form of S. And lower part of the back we usually call lumbar area, which is little curved in it. It ends with a tailbone or coccyx, we'll say. This is more vulnerable because the bone structure is not very stable. Bone structure has multiple vertebrae. Unlike knee, there are only two, one big thigh bone and tibia. Unlike knee, this part has multiple areas which are vulnerable for either prolapse or pain. So this pain, because of this particular issue, there is a more common is a back pain. When you overall you see statistics, back pain is much more common than knee pain or heel pain or neck pain. So because of this particular structure. And the knee has little more upper body weight and it is strong bone, that's why we can sustain for a long time. So knee pain usually you will get it in some of the old age, or if there is any injury to the knee joint as such in the sports or in the running or in other activities. If there is any injury to the knee, there can be more issues of the knee pain. You are able to follow? So actually speaking, I said here is yoga therapy, but I use it combination of a therapeutic exercise. More of a medical terminologies, but I use with the context of a yoga. So yoga has a definition of a body, saying we have 5 different bodies in all of us. You agree? Let's see what are those 5 bodies. If you know, well and good. If you don't know, learn it now. So first body they call it as physical body. And all the therapies are designed accordingly and around these 5 bodies. We all have a physical body existing, visible body. In Sanskrit they call it as Annamaya, the body which is made up of food. So gross physical body. Second one, vital body. Third one, emotional body. Fourth one, intellectual body. Fifth one, bliss body. Is it? Are we able to accept this? There is a physical body. In that physical body, there are different functions happening. Heart is beating, food is getting digested, breathing is happening, thinking is happening. There is a metabolic activity throughout our body. Then we call it as a vital body. We can accept. The third one, there are different set of emotions in all of us. So that particular body or a sheath or a layer can be called as emotional body. Fourth one, intellectual. What we are trying to understand by all this explanation is for our intellect to understand what is this concept and how I can apply for back pain, neck pain, knee pain. So I am understanding at the level of my intellect. So that layer of knowledge or intellect is called as intellectual body. Fifth one is a bliss body. Bliss body is a happiness body, where all the people of entire world wants only one thing, one goal of life. Can it be clubbed like that? Irrespective of whatever philosophy, whatever religion, whatever we believe, not believe, or cultural backgrounds, just one simple goal of life is I want to be happy and I want to avoid misery. Okay? In Sanskrit they call it Sukha Prapti. I want happiness to be mine and I want to avoid misery. Pain is a misery. So I want to avoid. Is there anyone who wants, I want unhappiness and I want to avoid happiness? Nobody in this world. It's a simple philosophy. So here, context of application of this therapy is, we will apply these techniques at all the levels. For physical body, we will design some small exercises, some diet modification, some medicines, if at all you need, if there is a more pain. Anything you do it at the level of physical body. For back, neck, knee pain. Are you able to follow through? Second one, physical body also has an influence of the way the inner metabolic activities works, the way your energy system is there, the way your basal metabolic rate, the engine heat. If you consider body as an engine, there is some amount of engine heat in all of us. The person who is eating more but not able to put on weight means his body's engine heat is so high that any food he adds, he'll burn it. And the person who is eating less but still gaining weight means the person's body's engine heat, we call basal metabolic rate, is less and he will store more. So that's our difference. In this kind of situation, we use breathing technique. Switch on this way. We use breathing technique to alter the set of engine's heat, which can be responsible for back pain also. So breathing techniques or any other local heat generating techniques. In the traditional Chinese medicine they use moxie. It will be some heated herbal stick which has burning, and we go very close to the skin and you feel the subtle energies are being cleansed. What is happening? Heat is more and we are applying the heat to the near surface of the body. There is an increased blood circulation. Increased blood circulation, body's repair chemicals will be more at that area and you feel relief. So some of the techniques. So now at the back of your mind you can think, okay, for back pain I can use multiple techniques. So third one, at the level of emotions. If I am so much stressed or upset, think of a day where you are absolutely upset with some bad news. You start feeling tiredness very easily. You feel a neck pain or something, stiffness. I don't feel very comfortable. I'm not able to get sleep. Also, it is simply so all the mobiles can cause a lot of emotional troubles. So our topic is emotion. Every sound is creating vibration. It's okay. We are using this as a tool to learn. The sound waves of that mobile is creating little anxiety in me, and when I hear this, my adrenal glands, there are small glands just above the kidney, we call adrenals, which is around 10 by 6 by 3 centimeters size. All of us have, irrespective of Indian, Chinese or whatever country, we all have. So we produce with that stressor, so that is the stressor for me, and I produce those hormones. Those are called as adrenaline and noradrenaline, stress hormones. These stress hormones will make my body and mind to get prepared to fight with the situation or flight or fright. 3 F's. Fight, flight, run away, or get frightened. So what happens there? These hormones will increase my heartbeat because there is a need to respond. My breathing increases, my blood glucose increases, my alertness increases, your muscles contraction increases, especially smooth muscle, skeletal muscles. 3 parts of your body doesn't work much: digestive system, reproductive system, and endocrine system. At the time of stress, you don't need to respond with these 3.
How about friendship?
Huh?
Friendship. Fight, flight, frighten, and friendship. If you make a friendship with that sound.
So yeah.
It's positive.
See, then we have to define the stress in 2 ways. I am talking of negative stress, we call distress. He is talking of a positive stress. You are getting married, you are getting promoted, you have a new friend. So it is a positive stress. Still there is excitement of bungee jumping, you jump from a very height. So you feel, oh, my adrenaline rush, you go into that roller coaster ride. It is a happiness. You are secreting the hormone, but the hormone secreted will not cause any de-stress in the body anywhere. It is called as eustress. Good question. Eustress. Happy, stress, and distress. Distress is unhappy. This is causing bodily or emotional or chi levels or energy levels imbalance. So this stress response causes my muscle stiffness, and if the muscle stiffness goes for a little longer time, muscles will go into a kind of a spasm because they are holding for long, they will want to rest. So suddenly they will become squeezed in one layer or one group of muscles. So that is one of the commonest cause of non-organic pain. If you go to doctor will check all those things, okay, it's fine, everything is fine, take an X-ray is fine. I think there might be some muscles spasm, and I will give you muscle relaxant. What we write and give is some medicines which makes your muscles relaxed and reduce your pain. What we give. So ultimately what is happening? Stress. This is root cause. Everything. Root cause is this: I am giving medicines for the physical body's muscles. So ultimately I am not giving complete treatment. Agree? So emotional level of workup to let out the emotions, as we have done yesterday a bit. Some of these. So today we will do in a different pain relief mind workup also in middle. So this one level I will be able to do. Intellectual is understanding about the pain. Why is pain? Is it my posture is not right? Is it something is not okay? Disease or not disease or other thing? Is it that I am stressed? Third one is, last one is happiness. I want to do something for these people with back, neck and knee pain that they feel happy. So there can be simple Ayurveda techniques which enhances the local heat generation by using oil, oleation, oil massage or pain relieving medicines are there. You see, if you have pain, you apply some balm. Okay? Apply some balm and you feel a local irritation with that particular application of balm, and you temporarily forget, the body will forget the pains. So using techniques at a different level is a concept today. What you understand? Any questions till now? Okay. You could grasp this easily. Yes.
ವಯಸ್ಸಾದ್ಮೇಲೆ ಸೌದೋಗ್ಬಿಡುತ್ತೆ ಮತ್ತೆ ಎಕ್ಸ್ಟ್ರಾ ಗ್ರೋತ್ ಬೆಳೆಯುತ್ತೆ ಅದು ನಿಜನಾ?
So mom is asking, after a certain age your bones will get wear and tear effect. Is it really true or it's something just we imagine? It's really true because we are using our bones at a different areas, and as I told, these 4 areas will get more chance to get a wear and tear effect. So that's the most commonest cause of pains in old people. We'll say OA, osteoarthritis, or RA, rheumatoid arthritis. It's a rheumatic. We'll not go into much technical. This much is all.
Can I ask something? The vital body, you
Yes.
say when you are very skinny and you're eating this very skinny, can you change that?
We can change this. Yoga is only system in this entire world which actually reverses basal metabolic rate. For example, if I do gym activities, my demand for the muscles, protein or glucose increases. So my consumption increases. And if at all suddenly I stop the gym activities, my consumption is still the same. So I can tend to gain weight. Yoga on the other hand, it will reduce the basal metabolic rate or adjust basal metabolic rate. So there are some nadi techniques, breathing techniques can be used in such a way that it can reduce metabolic rate of the body. So it is something very fascinating. And yoga can also work on smooth muscles. All the aerobics, exercise, dance programs works only on the skeletal muscles, the muscles which are on the skeleton. There are no therapies which can work on the smooth muscles of the body inside. So neti, when you do the nasal cleansing, vomiting or cleansing the colon, we are working on the smooth muscles of inside. So it's something very fascinating even for the medical field. So eustress is a normal, happy stress which is causing no issues at the level of mind and body. Distress is the one which will cause. Okay. Eustress example, getting married, getting promoted, getting a new friend, so forth. Distress is the one you lost some money, you lost some relationship, you had some terrible shocking news you hear. So that's distress. It affects at different levels. So therapy is also similar, should be designed. So usually I use two sets of exercises, isometric and isotonic. Is it okay that I will go a little fast with this so that we do more exercises? Isometric means the exercise in which the muscles are not getting shortened. Without shortening, the muscles are still working. Say for example, I am pushing a wall. I push wall. So at the back of your mind you think our focus is neck, back and knee. So exercise can be designed by these techniques. I use pressure putting onto the wall and these muscles are working but without getting short. So that kind of exercises are called as isometric exercises. We use it around the neck, around the back, which I will teach you. Isotonic is one where example, my biceps muscles, when I lift some weight, it's going to contract. So shorten the length of the muscle. Exercises where there is a shortening of the muscle length called as isotonic exercises. So exercise can be designed into isometric, isotonic. I will teach now itself. We do. This is ಸ್ವಲ್ಪ exercise, ಸ್ವಲ್ಪ theory, ಸ್ವಲ್ಪ exercise. For neck, usually I use isometric neck exercises like this. Shall we go do and then go ahead so that it will be easy to understand. Hold your right hand like this. Your hand touching the head. With your hand, you press to the head equal pressure, and with the head equal pressure to the hand, so that my neck muscles contract, work without reducing in length. So isometric. So this is called as isometric neck exercises for neck. Okay. Press. Hold it for about 3 seconds to 5 seconds. 1. Keep pressing. 2, 3, 4, 5. Slowly release. On left side. Press. 1, 2, 3, 4, 5. Release. Interlock your hands. Put it in front of your head. With your head pressing the hands in front, with your hand pressing the head at the back. Press. 1, 2, 3, 4, 5. Slowly release. Take your hands at the back. Press your hands to the head in front and head to the hand at the back. Press. 1, 2, 3, 4, 5. Slowly release. Again, interlock your hands. Keep it in front of your chin. With the hands, you are pressing up. With the chin, you are pressing down. Not pressure on these muscles, neck muscles. Like this. 1, 2, 3, 4, 5. Stop. So at the back of your mind, you can design 1, 2, 3, 4, 5 exercises, each holding for 5 seconds, 10 times. Morning 20 times, evening 20 times. One set of exercises. Holding like this, 1, 2, 3, 4, 5. So like this we are going to do 10 times. Not maybe on one side at once, or one side, second, third, fourth, like this 20 times. So 10 each. So you are designing a set of exercises, isometric neck exercises, 20 times morning, 20 times evening for first 1 month. Holding for 5 seconds. Second month, increase number of holding. So you are making the muscles hold, keep pressure more. Pressure increases, muscle strength increases. Muscle strength increases, the muscles can support your spine well. so that pain reduces. Interesting. Second month you are going to make same exercise, 10 seconds holding, 20 times morning, 20 times evening for next month. 2 months will be finished. Third month you can make it hold for 20 seconds. And this I hold for 20 seconds. 1, 2, 3, 4. So you are progressively increasing the resistance on the muscles. Is it okay to follow? One more we can add like this. So here I'll do one more set of exercises we call ROM, range of movements. 1,